gonna get on, do this.
Not scare him, get you all sorted, all right?
John? Do you remember where you are?
King's College Hospital, London.
Thank God.
A major trauma centre.
Hit the curb, jackknifed onto the verge.
Have we got a good pulse? Have we got an output?
And one of the busiest A&E departments in the world.
He will probably scream, but he won't remember.
No, stop! Ah!
A place where love,
Come on, sir. Let's go. Up you go.
No.
Yeah.
life,
There you go.
I love you.
I love you too.
and loss
It's all right.
unfold every single day.
Don't cry. And we'll make sure Mummy stays with you. Well, listen.
Right, who's not busy? Squeeze that.
We can't give up on her. Come on. We've got to be strong for Mum, if it is the last bit. Hey.
All the patients you're about to see were treated in one department.
Well done.
In just one 24-hour period.
I never cease to be amazed at the robustness of human beings.
I love you.
And the strength of their relationships. Love, it's a reflex. It's what you do. For many of the families, despite the devastation that they may be facing, they give unconditional love.
We need the music running through the waves and stuff.
Registrar Des will be overseeing resus for the next 10 hours.
Hello, Des.
Hi, Des.
You recovered from your night? No, nor have I. I feel like a zombie.
I woke up at 5 this morning. Wide awake.
I did that yesterday morning, and then this morning I was awake at 2.
I had a fascination with gore and horror movies when I was a kid, I guess, and it seemed like a natural progression to move into medicine as a result, as well as the obvious desire to want to help people.
My chick in majors, I think they'll probably send her home. I think they were just anxious and wanted to see someone tonight, even though I think the bleeding probably was easing up a bit.
Okay.
I'd worked in emergency departments in Ireland for a couple of years before coming over, and thought that I had probably seen it all. And boy, was I wrong. There isn't a day goes by in King's that I don't see something I've never seen before.
Could I trouble you for some helping medicines for the gentleman in number 2? All right?
All right.
Thank you very much.
That's all right.
Thank you, staff.
Oh, you've got one of those old man mints, don't you?
Did you buy them Murray mints?
Thank you.
You know, I'm not saying. I'm saying that you're selling yourself short by having the old man mint.
That's not what you're saying at all. Don't try and dress it up. Don't try.
I'm going to try one, but I don't think it'll
fine.
be good.
I'm not coming back. You can't make me.
People are unfortunately capable of doing the most awful things to one another. But people are also capable of doing some of the nicest and kindest things that you would never imagine would happen in a busy sort of urban area like King's or the centre of London. So sometimes it's probably the acts of kindness that surprise me more than the acts of cruelty.
emergency ambulance. What's the address of the emergency?
We're on Norwood Road in Herne Hill. We're outside number 47.
So tell me exactly what's happened.
Well, I just saw it as a lad on a bike. I think she pushed her over, maybe trying to mug her, and she fell over backwards off the curb and really slapped the back of her head on the road. She's breathing like quite strangely. I'm not really sure what to do.
Is there any bleeding?
I can't see any, no.
At the moment, just try to reassure her. I mean, want to try to keep her as still as possible. Keep your eye out for the ambulance. Wave it down when they get there, and we'll get the help there as quickly as we can.
King's College Resus. Okay. So we got no GCS on her. Right. Okay, I understand. Okay, many thanks, bye. Are we any anesthesiologists?
Adult trauma call, 4 minutes. That's adult trauma call, 4 minutes.
What is it?
20-year-old female, single punch to the head, abnormal posturing, blown pupil, business.
Oh.
She's probably fitting, is she?
Probably.
An unidentified woman is being brought to resus after being attacked whilst making her way home. She's been punched in the face and knocked unconscious.
That's you.
Put a vomit. Okay, let's roll her over and suck her out. Thank you. Thank you.
Right, what I can tell you about this young lady,
yeah.
She was believed mugged by a cyclist coming down the road, and she's fallen and hit her head on the curb. When we arrived in a GCS of 3, she was posturing. The right pupil was size 4, left pupil size 6, vomiting with trismus. We can't control the airway. Also, she's got quite a large bump, I think, on one of the other sides of her ear. She's 93 over 67, sat for 100%,
yeah.
and that's all we can do for a rapid removal. So. Can
we roll her just to suck her out a bit, just while we get everything else organised?
Okay, to us, yeah. Run on your count, Jackie.
Yeah, 1, 2, 3. Is someone getting all the drugs and everything?
You get an adult suction. When you know very little about the patient, you need to weigh up the benefits of what you think is the right diagnosis, the right treatment, the right action to take, versus maybe that decision being wrong or maybe that treatment being wrong.
Have a look for an adult yanker for me.
Adult yanker next door, yeah. Okay, on Jackie's call.
Ready, steady, back.
Okay, lovely stuff.
Let's get that sleep out.
Yeah, go for it.
Watch yourself.
Yeah. We hope that we're able to diagnose everything just from having the patient in front of us.
Right now.
But it is that decision that changes everything for everybody.
No.
Sorry, you broke down. 10644 was that?
I got them out here.
Don't worry about the rest later. Subject to what you find clinically.
Just suck it out with the stuff if you've got loads of vomit in there.
Just take it off.
A young woman has been brought to resus after being attacked 36 minutes ago by a stranger in the street.
Oh, Jesus Christ.
She's not a fan of that.
She's fallen and...
Got sats or anything, yeah?
That's 100.
For bradipneic. So as soon as you're ready with...
Bougie.
And can someone do...
Blood pressure's 15769.
In trauma, we have what's called the golden hour, where we try to stop life-threatening problems within the hour. If a patient comes and is delivered all nicely wrapped up and they're intubated, then their golden hour is already well underway.
1 to 6 millimetres.
Watch out, everybody.
Okay, we got no cricoid on.
That wouldn't have stopped that anyway.
But when they come to us without having any of those interventions done, it means that the clock is already well and truly ticking.
It's not fasciculated yet.
Can someone just recap and tell me what the precise history was?
She was a cyclist.
No, she was walking home, obviously, and a cyclist came up, punched her in the face. She fell back and hit her head on the curb.
Do they know who she is?
As in, any ID on her? Not yet, I don't think.
The old bill there, so I'll ask the old bill in a
And
minute.
can we just cut what's left of that shirt on both sides so it'll come off more easily?
6.2 BM.
It was a Wednesday. I came home and got changed and arranged to meet a friend in the pub. We left the pub about 10:30. I remember trying to decide whether I would take the bus or just walk. My mind was filled with sort of mundane conversations with myself about that. When I heard a crack, it really stood out sort of above the sound of London at night. Up ahead of me, I could see a man on a bike, sort of standing on his bike. I thought I could see something at his feet, but it's sort of in the shadows between cars. When I got there, there was a woman lying on the ground. She was just completely unconscious. And I realised that the crack I'd heard was her head hitting the ground. She was really alone. She was on her own. I didn't know who she was. She had no people with her. So I took my phone out of the pocket to call 999, and I remember sort of fumbling slightly to unlock it and to dial the numbers, because in the panic I'd almost sort of forgotten how to use it.
So at some point we need a chest X-ray.
And an orogastric tube.
Okay.
It's unlikely that we're going to wake her up and do anything with her, given the crack in her chest and the neurology that she's demonstrating.
While I was still making the call, the 999 call, I sort of knelt beside her and rubbed her arm, because it's all I could think of to do, really. And I think I even asked if she was okay, and obviously there was nothing. She was just unconscious.
Sorry that you're having to be here for me, but thank you very much. I thought I'd really mangled my hand. Oh, the pain was just incredible. I won't be able to use that hand for a while. Oh dear, excuse me.
I fell on the floor, I got out of bed, I landed on the floor, and I could not get up. So my wife rang up the medics.
So why did you fall? Your collapse?
I didn't have a fall. I just had no body strength.
90-year-old Frank has been brought to resus after his wife found him collapsed at home.
I come from circus, and everybody's fairly strong.
Yeah.
And I used to break animals, horses and things like that. And I picked up a horse before now, so I've always been strong. But I used to practice judo. I've been a weightlifter. But I mean, I've always been strong, and I could not let go off the floor.
My great-great-great-grandfather started off the circus busking in the streets with budgericars.
Okay, just going to tap on the chest a little bit.
I consider myself a fairly healthy man, considering I'm 90.
Yeah, you're doing well, my friend. You're doing very well.
And when he died, he gave each of his 3 sons a circus. In those days, quite a big thing. And my grandfather, Fred, he had a circus when about 1834 or something like that. And he did very, very well. He was doing great big stuff, you know.
My name is Danielle. I'm one of the doctors.
Oh, join us.
So tell me why you came into hospital today. What happened?
What happened? Well, I got out of bed to go and have a tinkle, and I hit the floor. I couldn't get up.
Okay.
I couldn't get up, and I'm a strong man. I've always been very strong, and I couldn't get off the floor.
In those days, the royalty never went to the circus. They said, you bring your circus to us, which he did. And he took the circus, whole circus, to Balmoral and did the show.
So what I want to do is have a listen to your chest and feel your tummy and just have a look at your
We're going to get familiar, are we?
So that's what I'll be doing, if that's okay?
Fine, you
Yeah?
can do anything you like
Okay.
My mother was in circus too, all of us. Schooling was a bit tricky because she'd go into a town. So my mother would take me to a school, which I would go every day until Friday, then I'd be off. And then next week I'd be in another school in another town entirely. And it went so on and so on and so on for years. I probably went to 200 or 300 schools. And they'd all stick me at the back of the class because they knew I wasn't staying. And I'd finish up another town, another school. It didn't do me any harm. It's what circus people did in those days.
It's been over an hour since an unknown woman was punched and knocked unconscious. Doctors are assessing the extent of the damage to her brain.
Got home about midnight and I sat up for another couple of hours. I had another phone call from the police. They implied quite strongly that she was probably going to die. I asked if they knew who she was and if she had any people with her. He said that she was from overseas and her family were on their way. I was thinking about her last conscious moment, sitting or lying in the road with strangers. It must be a very sort of lonely place.
Yeah. I think we should be giving some mannitol, actually. Not mannitol, hypertonic. That's quite nasty. Are the numbers up here? Is that?
B183 982.
When my sister was born, I remember her as a little baby, and I was looking at her, you know, at that small baby, and And I was kind of proud she was my sister. I think she was quite independent. But I remember that when we were teenagers, I was a little bit older and she was younger. And when she started going out, and I felt that feeling of protection, I wanted to be sure that she won't get into some problems. When she was younger, I wasn't thinking of the possibility of her leaving Czech Republic. But it was quite common at that time that girls who just graduated, they left and they wanted to study English and they took the advantage of being au pair. I felt actually proud at her that she was able to suddenly to go and, you know, to find her own way.
Hello, you're the neurosurgical registrar. Just had a young lady brought in via resus who was punched in the face by a cyclist, and she's fallen backwards onto, landing on her occiput.
At that day that I found out about what happened to Susan, I felt strong need to be close to her, to be there, to find out more details, and really, because we weren't sure, is she dying? Was she dying, or what's happening? I just remember when we sat in the plane, and I didn't have to manage anything. You know, my bag was in the plane, my daughter was with somebody, and we just had to go. So at that moment, the emotions came, and you know, I started crying, and I think I was crying for the whole flight.
She's got frontal contusions and a subdural and a very significant amount of midline shift. We thought that one of the issues was that they didn't have control of the airway. So what we did was secure the airway and ventilated her down. The pupils both came down. It's quite a nasty scan for that history, really.
I even remember I took a few books, Czech books, with me, that if she is still, you know, in some kind of sleep or whatever, and that I would just sit next to her and read her books, and you know, I was thinking this way. I was trying to think how can I help, what I can do for her in that moment.
I would make the worst nurse ever. I'd be like... Things that you don't think about with stuff like this is how much it impacts, because, for instance, I can't moisturise my hands.
I can't do my daily moisturising routine.
Can't moisturise my toes. It's just like...
My little toesies.
My little toesies.
You can have one really, really moisturised hand.
I can't wank.
Vinny. Oh, my Lord.
Seem to be down here now.
The neurosurgeon's going to take her to the theatre?
Yeah, I'll be ready in half.
Okay, fine. So she'll go from here then, yeah?
Suzanne's CT scan has revealed life-threatening swelling in her brain.
Susan.
Yeah, around there.
A lot of edema early on.
That's what I'm saying. That she's
Within
an hour.
It's under an hour.
Yeah, at 36 hours, that's going to be... She's not, I don't think she's going to survive that.
They know who she is. They're just trying to get in touch.
It's just shocking.
When Suzanne came in to us, I think many of us may have seen a younger of ourselves in her. She was a young woman essentially minding her own business, just walking down a street. And this random act has put her in this awful position. And I think it touches everybody who's involved in her care, that there but for the grace of God go I. And it could have been any one of us. And I think that kind of sticks with you then, how unnecessary this is, how needless it is, what a waste of a young, beautiful woman. It's just, it touches everybody, I think.
Her brain is very, very, very swollen, but you get this thing which is called, they call it muffining, which is where you take off part of the skull and then the brain just comes out like a muffin out of a cupcake holder. She could easily die from it, I'd say, which is awful.
This young lass is... thank you very much for coming.
Neurosurgeons will operate immediately to relieve the pressure on her brain, which could cause permanent damage.
When I first saw her, from one side I couldn't even recognize her because her face was swollen that much that it completely changed her features. But it was my sister, and I was kind of happy that I can be close to her.
Bearing in mind that you got to a stage where you couldn't get up this morning, I think we should keep you in hospital for a little while until you're a bit better. But in that situation, we do have access to emergency care to help your wife at home.
Well, see, the thing is this, she's disabled.
Yeah.
And, she can't literally do anything without me.
Resource, Jackie speaking. Is this Marion? Let me go and give him the phone. Hold on. Mr. Jeanette.
Yes.
I have a lovely lady called Marion on the phone who would love to speak to you.
Her name is Miriam.
Miriam. Oh, I'm sorry, I said. But she'd still like to talk to you, whether I got her name right or not.
Hello, love. I'm lying on a bed here, and I've got 8 places where they've stuck things into me. And now they're going to take me up to the ward. I've never met such a nice bunch of people. They're lovely here. This young fellow has stuck another needle into me. Seems to think that I'll be out tomorrow evening or the next day. So everything's all right, and I wish you'd come here and stop them sticking needles into me.
My wife was a stilt walker, a roper. She used to stand to have knives thrown at her. The only thing is you had to worry about the board that they used to stand against. You had to make sure it was wet. If the board was dry, the knives would jump out again sometimes. Then she had one big scar down her leg where a knife jumped out and cut her.
And no, I'm actually in the lap of luxury here, except this is the most uncomfortable bed I've ever been on in my life. Oh, it's a terrible bed, this is. But they say the beds upstairs are better. So I'll be going up in a minute.
There were 18 chorus girls and 18 chorus boys in the show. Beautiful show. Beautiful girls. And I could have got off with every one of them, the boys and the girls. But I didn't, because I had my Miriam.
I'll see you soon. I'll see you soon, dear. Yeah. Bye-bye, love.
Yeah, he used to own a circus.
Did he?
Yeah, Emily told me he used to own a circus and he had horses and bears.
Oh, my
and Emily's really excited about the bears because she can see horses in a field anywhere. But bears. That's right, you said he used to own a circus, didn't you?
Yeah, with bears and horses.
Thank you.
Oh my gosh, you didn't tell me that one. Because you still have the bears.
I'm off.
I just have a tool belt.
Oh look, she's going somewhere. Ask him now, quick.
I think I'm cured.
Goodbye. So we need to do one quick question.
Yeah.
I've heard a vicious rumour that you used to own a circus.
Yeah.
And you had bears.
Yeah.
Did you, like, Did you give bear hugs?
You're in big trouble if you're getting a bear hug.
Everyone loves me, bears included.
I think he means a bear hug from a bear.
Yeah. Everyone loves me. They won't do that to me. You should meet my dog.
Bye-bye.
My dog tries to do bear hugs, doesn't he, Ed?
Totally.
Hello, King's A&E. Yep. Yep. 10 minutes. 12-year-old male, pedestrian versus car, intubated, head and pelvis injuries.
ETA?
10 minutes. Lovely, thanks.
12-year-old.
Bye.
Okay, that's fine.
Pediatric trauma, that's pediatric trauma, 10 minutes.
A 12-year-old boy is being brought to King's by air ambulance after being hit by a car on his way home from school.
What is
A
it?
12-year-old, tube from Hems with head pelvis.
That's fine, we'll CT the whole of him. Right.
Indeed.
Right, have we got PICU coming because this kid is intubated?
Trauma.
Lovely. Can you order cross-match for 4 and all the bloods, please, and a CT scan, head, neck, chest, abdomen, pelvis. Right, Mudassar is on his paediatric secondment, so he's going to do the primary survey. You're going to do the fast scan. You're going to do the bloods.
Oh, yeah.
Saves you having to get in after. Thank you. They said 10, 5 minutes ago. It's tragically predictable that children will be hit by cars, but how you respond to that is very much, it's a drill. It is like the F1 pit crew. Everyone's there to do their role and to look for the things that could kill a child quickly, and then look for the things that could kill the child slowly.
Is it here?
Not yet.
No. Very long 10 minutes.
The whole point of the HEMS crew is to bring the hospital to the side of the road. It makes you more alert because that means that the ambulance crew have recognised that this child's more seriously injured.
Mate, you can't come in this way. Yeah. It's here.
I have between you and Aidan, one of you's on fluids and one of you's on monitoring.
I'll do mine as well.
Hello. Yellow thing. Yellow bit. Okay, guys, this is Tom Wilkins. He's 12 years of age, estimated to be about 40 kilos. He's a pedestrian hit by a car. He was probably skived off the side, hitting the hard parts of the car, broken fog light, and hit the A-pillar at the base of the car. No bullseye on the windscreen. He was found as he lay off the road in the mud, GCS of 10 with a motor score of 5. Quite agitated. Mother was there, says it's completely out of his character. His injuries from top to toe. He's got a closed head injury with a big swelling left frontal. He's been bleeding out of his nose, nothing out of his ears. Interventions-wise, he was intubated with our new protocol, fentanyl, ketamine, rocuronium. Second dose of rocuronium in the tank, so he's well paralysed, okay? Grade 1. Pupils have always been 3, equal and reactive.
Family?
Mum's on her way up with the cops.
Thank you. Right, guys, are you happy with the tube? You get me a line in that side, please.
You want your
right. Tube, primary survey, E-fast, line. Thank you.
I've got fluid. I can hang them up there. We can connect.
Don't run it. Just put it on.
No, I'm not running it. I'm just putting it up.
Lovely. Children are inherently fit, strong little creatures. They don't yet have weak hearts and smokers' lungs and all of that. So actually, children's little bodies will compensate for a long time, and they'll hold it together and hold it together and hold it together and then crash. So you are often looking for very subtle signs. That's why it's really important to stand at the back, because you need to see the bigger picture of everything that's going on. Any abrasions on his pelvis, any blood at the meatus? I know he's got the binder on, if you can work around it. Otherwise, just tell me if there's any abrasions and we'll take it from there.
There's no blood in the meatus.
Great.
There's no abrasions on the
No blood at the meatus. And no abrasions around the pelvis. Okay.
Let's talk me this side.
BM is reading low.
BM is really reading low?
Pupils are 3 and reactive.
Do we try again? Yes, do it again. Pupils are 3 and reactive, and there's an abrasion where?
On the left temple.
Left temple. Okay.
And a big bruise on that side as well.
Guys, I'm going to order the CTs. I'm going to CT everything.
On the right,
Jacket
on the other
side,
side.
hands over.
Hands over onto some bony bit.
Ema, there's already fluids connected. You just relieve those.
Very slow trickle.
Slow
very,
trickle.
very slow trickle.
Hartman's. Is that
Yeah,
it?
very slow trickle. On that blood, I'd like a cross match for 4. Too big.
Okay, both lungs are up on ultrasound.
To blanket him up. He is just very cold, isn't he? Guys, CT are ready and they're waiting for us. So if we all start getting ready to go, as soon as we're all happy, we're going to go. Charles, you've not seen anything abnormal in your assessment?
No, I've just done the fast and that's all normal.
You're happy with the tube end. Pupils are still nice and reactive. Lovely, we'll head across.
On the day of Tom's accident, I was parked in my usual space opposite the school. I didn't hear anything that went on, and then the first I knew was Tom's friend came running down the hill, just shouted, "Anna, Tom's been hit by a car." And my initial reaction was, well, how bad is it? And he just said, "I don't know, but his head's bleeding."
So this is a 12-year-old boy from Kent, flown up after having been hit by a car, bounced off the side of the car, landed in a ditch, GCS of 10, with an injury to the left side of his face and head, left side of his chest, left side of his abdomen, left side of his pelvis, all grazed up. And he was GCS 10 with a motor score of 5. Pupils are equal and reactive. And HEMS tubed him.
I ran up the hill, sort of praying to myself that it was all going to be all right. By the time I got up to the top, I could see his head was bleeding. And he was very starey-eyed, almost looking through me rather than at me.
How old, sir? 12. He's a big lad, isn't he? He's got deep abrasions on his left temple.
Yeah, he's got a slight depressed fracture of his frontal sinus.
I just want to know whether we keep scanning him or whether we bail and go to neuro theatres.
We've got anything on the scan so far?
Skull fracture.
It was quite nerve-wracking being in the police car with blue lights on and sirens. You're thinking, gosh, why is this happening? This is urgent, I've got to get there. But you're also, your mind is distracted. I think it's the kind of denial mode sets in as to try and avoid thinking about, I suppose, what you might be greeted with once you arrive.
It's been 2.5 hours since 12-year-old Tom was hit by a car on his way home from school.
Are you happy? Do you want to go in and just make sure you're happy? If they'll let us, we'll take him upstairs. Nothing else major. So skull fracture, when they get a better light, maybe there'll be a little bit of blood, but not shift.
Okay.
So he'd be fit to go upstairs if you wanted him to.
Now.
Shall we?
Yeah.
Let's go.
Tom doesn't need immediate brain surgery. He's being taken to Pediatric intensive care, where he'll be closely monitored for the next 24 hours.
Fairly shortly after we arrived, a doctor came and saw us, and they did say initial signs, if you like, were good.
PICU.
So I sort of laid in bed with him You just lay there and you just quietly contemplate. And it was a bit like going back to the baby days again, when you're sitting there and you're allowed to nurture them.
The majority of things that we see are completely random acts. There's no reason for them to occur. There's nothing to indicate that they would occur. They're just random acts. And we try to see them as literally that, as random acts. It's being in the wrong place at the wrong time.
Some young girl, who she was 20 or 22 or something, walking home from work, some guy came up behind her on a bike, sucker punch, just punched her once, down she went, didn't get up. Massive frontal contusion, absolutely horrible scan. It's the kind of thing you're just looking at it thinking, ooh, you're not sure whether you will survive it or whether you want to. Unfortunately, you know what I mean? It's sad, isn't it? Everyone was a bit sort of, ooh, blimey, choked up about it, because, you know, she's just gone home from work. It was, 10 o'clock in the evening, and everyone's like, yeah, but I do that. Everyone else does that. Such a waste.
Yeah, but by the grace of whichever divine being you believe in.
This is it, yeah, absolutely.
Yeah.
Absolutely. So, anywho.
Lovely. How's the rest of the building looking?
Yes, fine. Yeah, it's looking good. So I don't mind if you wish to persist in babysitting.
I can loiter here.
When I woke up, I just saw my parents just sitting there, and then I didn't know what happened. So I just woke up, and then I thought, I don't know where this is, what's going on? And then, of course, they told me what happened. The type of driver I want to be is quite sensible and observant, but I want to be able to get there quickly. So, like, be able to get there quick, but then be careful while doing it.
Well, we met and married in 3 months. It lasted 65 years. We did quite well. It's coming home to an empty flat that drives me potty, you know. Oh, I do miss her. Unbelievable, really, isn't it?
When I woke up, I remember seeing my family. My dad, my sister, my mom. And I was thinking, why are they here? Is there a party or something? I never thought of what happened. Because it's not gonna help me and it's not gonna help anyone else. So, you know, I just focused on getting better. When the police returned to give me my phone, my bag and stuff, and then there was also a card, wish you well card. So that's when I first realized then, there was Andrew who saved my life, really. because if it wasn't for him, who knows? There were some people who thought I was drunk and didn't bother.
I was really nervous before meeting her, but when I met Suzanne, she seemed like such a sort of buoyant, resilient person who seemed almost unfazed by what had happened, and I felt really good about that.
I kind of thinking, I've met this person who was not nice to me, but on the other hand, I've met this person who was lovely to me. So it kind of compensate for, for what happened. Saved my life, I have to say. Saved my life.
Started off with like the slowest day ever. We've got lack of space everywhere, it's manic.
He was driving his lorry at 50 miles per hour, bullseye at the windscreen.
Death terrifies me. I'm not ashamed to say that. The process of dying absolutely terrifies me.
They're not going to resuscitate Mum, and they're not going to put her on a ventilator. They're not going to do that for Mum.
you.